pure tone audiometry. So the questions we are going to see are: what is the normal threshold? What is the normal threshold? Next question is, what are the symbols used in the pure tone audiometry? Next question is, what are the pure tone audiometry findings? So this is divided into three. So what are the findings in case of the conductive hearing loss, in case of sensorineural loss, in case of mixed hearing loss, as well as in case of otosclerosis? So there are 4 parts to this. So what are the findings in each of them? So we'll find out the answers to all these questions. So firstly, what is a pure tone audiometry? So pure tone audiometry is nothing but is a sound of a single frequency. It is nothing but a sound of a single frequency. And it is an audiometer. And other thing to note is that an audiometer is a device that generates a pure tone. So audiometer, it generates a pure tone. And what is to be known is that a frequency can be increased. Frequency can be increased or decreased by how much? By 5 hertz. Next is that a threshold for the air conduction. A threshold for the air conduction. So this is nothing but threshold for the AC of sound frequencies from 125 to 8000 hertz, and a threshold for the bone conduction of sound frequencies. So this is from 250 to the 4000 hertz. So this is measured and a result is plotted on the, so it is measured and it is plotted on the audiogram it is plotted. Next, looking at the normal threshold. So the normal threshold is, in case of the air conduction, it is 15 decibels. And in case of BC, it is 25 decibels. So now we move on to the symbols of the PTA. So what are the symbols of the PTA? So the symbols we look at in case of AC unmasked. So in case of AC unmasked, we need to know that there is always comparison between right and left. In case of right, it is nothing but a circle. In case of left, it is an X mark. Then we move on to the AC masked. So in case of AC masked, it is a triangle on the right and it is a square on the left. Then looking at the bone conduction, and we are looking at unmasked. In case of bone conduction unmasked, in case of the right, it is a left bracket, and in case of the left, it is nothing but a right bracket. Now moving on to the BC masked. So in case of the BC masked, it is a square bracket in case of the right, and in case of the left also it is a square bracket of the opposite side. So in case of there is no response, how do you mark? In case of no response, it is, in case of the right ear, it is a circle, and in case of the left ear, it is a cross with an arrow. Now we move on more in detail about the findings in case of the PTA audiogram. So we look at the findings in the PTA audiogram. So in case of the conductive hearing loss, how is it? So in case of the conductive hearing loss, the AC, if you see, it is abnormal. And the BC, if you see, it is normal. BC is normal, and there is a presence of the air-bone gap. So there is air-bone gap which is present. Next we see is the SHL. SHL is nothing but the sensorineural hearing loss. So here the AC and the BC, they are both abnormal, and there is no air-bone gap. So there is no air-bone gap, but the both AC and BC are abnormal. Next we move on to the mixed hearing loss. So in case of the mixed hearing loss, so here what we see is that both the AC and the BC, they are abnormal, and there is the air-bone gap. The air-bone gap is present. Then we focus on the presbycusis as well as the ototoxicity and also the noise induced hearing loss. So the noise induced hearing loss, so here what we see is that the higher frequencies are affected first. So higher frequency are affected first, and the findings here is that there is a slope. There is downsloping or the descending audiogram. Next we look at the early stages. In case of the early stages of the Meniere's disease, so early stages of the Meniere's disease, and here the lower frequencies are affected first. So the lower frequencies are affected first. So here what we see is in the audiogram there is the slope, that is there is upsloping or the ascending audiogram. Next we look at the early cases of the noise induced hearing loss. So in case of early cases of noise induced hearing loss, here there is a acoustic dip, and this is a characteristic dip. And this is both in the AC as well as the BC, and it occurs at the 4000 Hertz. Then we move on to the otosclerosis. So in the otosclerosis, this is very important. There is a Carhart's notch, and this is nothing but a dip is seen at the 2000 Hertz, and this is seen in case of the BC curve. So now we are going to answer our questions. So the first question we asked was, what are the normal thresholds? So the normal thresholds is nothing but, in case of AC, it is 15 decibels, and in case of BC, it is 25 decibels. The next question was, what are the symbols in the PTA? So here are the symbols of the PTA. We look at AC. First, AC can be unmasked as well as masked. So here we have the right and the left ear. So in case of the unmasked, it is nothing but, in case of right, it is a circle, and in case of the left, it is an X mark. Next, we move on to the masked. In masked, it is a triangle for the right and a square for the left. Next, we move on to the BC unmasked. BC unmasked. So in case of BC unmasked, for the right it is a left bracket, and for the left it is a right bracket. And then we look at the BC masked. BC masked. So in case of BC masked, it is nothing but a square bracket which is seen. So in case of no response, how do you represent? For no response, it is a circle and or it is a X with an arrow. Then the next question we asked was, in case of the PTA audiogram. So in case of the PTA audiogram, what are the findings in case of PTA audiogram? What are the findings? What are the findings in case of the CHL? That is the conductive hearing loss. So in case of the conductive hearing loss, the AC is abnormal. It is abnormal. Whereas the BC, it is absolutely normal. And there is presence of the air-bone gap. So there is air-bone gap is present. It is present. Next is in case of the SNL, SHL, that is a sensory neural hearing loss. So here there is that the both AC as well as the BC. So the air conduction and the bone conduction, both are nothing but it is abnormal. And there is no air-bone gap. There is no air-bone gap. Whereas in the CHL, what we saw is the AC is abnormal, the BC is normal. Whereas in case of sensory neural hearing loss, the AC and BC both are abnormal, and there is no airborne gap. Next we look at the mixed hearing loss. In case of mixed hearing loss, the both AC and the BC, they are abnormal, and there is the airborne gap which is present. Lastly, we look at the audiogram in case of the otosclerosis. So in case of the otosclerosis, how is it different? So in case of otosclerosis, there is presence of the Kerhat's notch. So this is nothing but there is a dip present at the 2000 Hertz, and this is nothing but in the BC curve.